Convention suggests health as an absence of disease. I think we can do a little better than that. Today, we're going to discover the social determinants of health. Welcome to the lives of Andrew Moneybags and Steve No Collar. Today, Andrew and Steve will be participating in the grand race of lifelong health, and you're here to help. Pop quiz. The answer is income. Across all genders and ages, life expectancy is directly correlated with income. Health stressors are not equally distributed. People of color and women suffer worse ill health effects than their white male counterparts in similar situations. But what about before all that? Let's take this back all the way to childhood. At what age does social development begin to have long-term implications on our health? The answer is A. In 1996, a report on the health of Canadians noted, "There is strong evidence that early childhood experiences influence coping skills, resistance to health problems, and overall health and the well-being for the rest of one's life. Quality early childhood education and care has long-lasting effects, especially on low-income kids. It can lead to lower crime rates, higher earnings, and even less dropouts." So, knowing what we know, we're going to have to make some minor adjustments before we can begin the race. Andrew's family lives in a big house in a nice suburban community. Andrew's parents are well off. His father is a CEO of a small manufacturing company, and his mother is an accountant. Steve's family lives in a smaller house on the other side of town. It's just him and his mom, and they get along the best they can. His mother works a full-time job on an assembly line at Sutton's Plastics, and her busy hours leave her little time to prepare food or interact with Steve. Alright, Andrew, you get a little something extra on your path to a long life in good health. Your situation affords you a healthy birth weight, a nurturing environment filled with attention and educational stimulation, and a diet rich in fresh foods. Here's a leg up. And, Steve, well, as a result of being shuffled from overcrowded daycare to daycare, eating a few too many TV dinners, and spending most of your days watching television, you're just gonna have to start right here, Steve. It's time for Andrew and Steve to start attending school. False. Factors outside of a child's control can often affect their ability and motivation to learn. Children from two-parent households already have a step up from their single-parent counterparts, with a statistically lower chance of behavioral and school performance problems. Low-income situations can lead to delinquency and may affect vision, hearing, and speech development. Poor performance in school can lead to aggression, delinquency, dropping out, and other lifelong behaviors and habits that can lead to poor health. Things are looking pretty good for Andrew. He attends a high-quality school in his neighborhood, makes lots of friends, and performs well in class. His parents are encouraging and involved in his homework. As a result, Andrew excels academically and maintains high grades that lead to scholarships and incentives to continuing education. And Steve? Well, Steve ends up in the smaller public school in his neighborhood. He tries to study hard but is often hungry and unable to concentrate. He struggles to develop his communication skills and has difficulties asking for help. Unfortunately, his mother does not have the time or energy to help Steve at home. As a result, Steve's academics suffer. He starts to work part-time to help his mom and feels alienated from his school system. He starts smoking to cope with the stress. Only 55% of Canadians are considered fully health literate. Health literacy is defined as the degree and capability of individuals to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Canadians with low health literacy are 2.5 times more likely to suffer poor to fair health. Andrew is finally ready for university. And you guessed it. Andrew's parents sent him off to a great one and help pay for his tuition. Andrew's previous success in grade school and high school pays off. He's granted a scholarship, integrates well into the university environment, and when he has troubles, he knows exactly where to go and who to ask for help. He graduates with honors and takes a gigantic step for the future of his health. Steve shops around for different universities for a little while, but things are looking grim. He's frustrated by all the forms to be filled for university applications, and wonders how he'll afford post-secondary without a scholarship. His mother's health is starting to fail, leaving her unable to work. As a result, Steve's meager savings are used to help his mother out. Steve is starting to suffer from depression, but doesn't know where to go for help. Instead, he tries to take his mind off the stress with his friends by drinking, smoking, and participating in risky sexual practices. We've finally reached adulthood. Surely things will get better for Steve now that he'll be old enough to be the master of his own destiny. Only 66% of all working Canadians have a stable full-time job. There has been a steady increase in precarious work or job insecurity in Canada. Between 1976 and 2003, having multiple jobs increased by nearly 300%, while standard full-time has only increased by 50%. Part-time work and self-employment have increased nearly 150%. Canada's percentage of low-paying jobs is at a whopping 23%, leading to one of the highest family poverty rates amongst Western nations. All of these factors have direct and statistical links to Canadian health and well-being. A stable job is a key element to a healthy life. As precarious work in Canada increases and stable full-time permanent positions continue to evaporate, the health of Canadians will certainly pay the price. Andrew's university education gives him a step up. He has the necessary skills and literacy to browse different postings and has developed a significant social and professional network with his peers during university. He manages to find a stable job that has great upward mobility potential. His employer offers him benefits, a drug plan, and vacation days. He has a career for life that will guarantee him an income to start planning for a steady future. Steve continued working after high school, putting in 45-hour work weeks at grocery stores, big box retailers, and odd jobs here and there. None of his jobs are protected by unions. He's often underpaid and does not receive any benefits. His mother's looking to move to a single-room apartment, so Steve works nearly 50-hour work weeks now to save a little more money. When Steve finally goes to a doctor to discuss his depression, the doctor prescribes counseling and medication. But with little time and no drug benefits, Steve opts instead to cope with his stress through smoking and occasionally binge eating. Which leads to our next topic, housing. Astoundingly, only 1 in 5 Canadians can find appropriate housing. This is related to continual cuts in government spending to provide and protect affordable housing, increasing levels of poverty and precarious income, and increasing private sector involvement. Furthermore, a study by the Toronto Disaster Relief Committee in 2000 determined shelters were overcrowded, had poor food quality and hygiene facilities, and were rife with theft, violence, disease, and death, both in shelters and on streets. While some mental health issues may precede experiences of homelessness, it has been shown that the daily conditions of homelessness, both material and psychosocial, exacerbate existing health problems and may lead to further issues. Inadequate housing may lead to exposure to health risk factors such as dampness, poor heating, and radon. Finally, excessive spending on housing can lead to stresses related to lack of resources available for other social determinants, such as quality food, education, and childcare. As for Andrew, with a stable income and ample resource, he's fortunate enough to find and afford a house in a comfortable suburb. The house is built in a new subdivision with access to green spaces, a safe neighborhood, quality schools, and quality grocery stores. He and his fiancée have big plans to start a family and know this is a great place to start their kids off to a happy and healthy life. When Steve finally moves out, he moves to another low-income neighborhood. There are no parks, the sidewalks are in dire need of repair, and a good grocery store is at least a 30-minute drive from his home. The building is old and unrepaired leaks lead to dampness and mold. Steve's health suffers on several fronts. He suffers from respiratory illnesses from exposure to the mold, feels unsafe walking around in his neighborhood, and is barely able to afford other necessities due to dedicating almost half of his paycheck to rent. What about food? Food security is more than just about feeling full. In 2004, nearly 10% of all Canadians suffered from food insecurity at some point. The health correlations are many, including both nutritional adequacy and social factors. Hunger may lead to malnourishment, low energy levels, and increased risk of diseases such as heart problems, osteoporosis, and cancer. Stress and worry about whether we will be able to afford the next meal also takes a mental and physical toll on our health. Lucky for Andrew, there are several high-quality grocers within his neighborhood. He has ready access to milk, fresh fruits, and vegetables. Furthermore, his stable work schedule permits him the time to prepare healthy meals for his family. As a result, Andrew's household is well-fed, fully nourished, and never worry about not having enough food to eat. For Steve, things have come full circle. As he continues to work multiple jobs to make ends meet, Steve has little time to go to the grocery store 30 minutes away, let alone prepare home-cooked meals. Instead, he buys prepackaged processed foods and frozen dinners, the only thing available at the local convenience store. And just like the beginning, Steve is malnourished, tired, and unable to perform well at work. His drinking, smoking, and eating are now lifelong habits, and Steve's only way to cope with the stresses associated with this situation. I wish there was a happy ending to this story. At 55, Steve might be diagnosed with diabetes, or he may suffer a heart attack, or have a stroke. This happens every day, and it's getting worse. Health is an individual responsibility. It's all of us. Ask the right questions to your local MPs. Inform yourself. Inform others, because someone else's life depends on it.